Alright, hi guys, a very good afternoon to all of you. Sorry for the short delay. Welcome to this part 3 of last minute revision. I think due to some reason the notification is not being sent to everyone, but I hope all those students, those who are live right now, will be enjoying this part 3 like we have already done part 1 and part 2. Okay, and before I start this session of part 1 and part 2, please let me know if I'm clearly audible and visible to all of you. Please let me know if I'm clearly audible and visible so that we can immediately start. Dr. Nilanjan Datta and other students, those who are live right now. So part 1 and part 2 we have already done, where all the high yield topics have been discussed, and as I have told you in the previous session that this part of the last minute revision will be equally beneficial for the FMGE students and for the NEET PG students, because all the high yield topics from the last 10 years we are covering in this particular series, where more than 10 parts will be there. I mean, this is the part 3, more than 10 parts will be there, where the aim is to cover more than 100 questions. Okay, please let me know guys if I'm clearly audible and visible, and then we can immediately start. Good afternoon, Dr. Yashraj and other students. A quick introduction before we start is about the Unacademy. If ever you are subscribing, you can use the duration that you want. You can choose the duration that you want, like 1 month, 3 months, 6 months, and you can use the code that I have given you, that is Siraj Ahmad 9. This code will give you a decent 10% off in your overall payment. Dr. Yashraj and Dr. Nilanjan, right? Am I clearly audible and visible? Audible, visible. Okay, good. So let's get started. The very first question that I'm having here, it's going to be a very quick session. Which of the following is true statement about the Rituximab, right? Rituximab, it's one of the very high yield topic. Rituximab among the monoclonal antibodies is one of the most commonly used monoclonal antibody. Okay, in the monoclonal antibody, one of the most commonly used monoclonal antibody is Rituximab, right? And although I have told you a couple of information already about Rituximab in part 1 and part 2, let us see how many of you guys can get this easily done. It is a humanized monoclonal antibody commonly used for bronchial asthma, act by targeting CD22. You'll have to find out a true statement. Okay, you'll have to find out a true statement, right? Can be used in the treatment of CLL. Please provide your answer already. All the students, those who are live right now. What do you think would be the possible answer for this one? All the students, I will be waiting for your answer in the comment section. I am using another system to check your comments here, and accordingly we will be doing the discussion. Please start providing your answers, all the students. It's option A is saying that it is one of the humanized monoclonal antibodies, right? Is it a humanized monoclonal antibody? How does a humanized monoclonal antibody look like, or how does the name look like of a humanized monoclonal antibody, right? If it is a humanized, there will be ZU in the name, right? ZU in the name will be for the humanized. Example will be your, let us say, a Bevacizumab. Okay, Bevacizumab is one of the example of the humanized monoclonal antibody. Okay, when the name is having XI, guys, XI means agar name mein XI hai, so that will be your chimeric monoclonal antibody, right? This will be one of the chimeric and not the humanized monoclonal antibody. Commonly used for bronchial asthma? No, it is not used for bronchial asthma, guys. The drugs that is used for bronchial asthma, or the monoclonal antibody that is used for bronchial asthma, right? The monoclonal antibody that is used for bronchial asthma that we are having is here Omalizumab, right? Omalizumab, that is one of the monoclonal antibody against IgE, right? Then interleukin 5 monoclonal antibody against this targets your IgE, right? Interleukin 5 will be your Mepolizumab and Reslizumab. Okay, Mepolizumab and Reslizumab, all of them will be ending with the MAB, right? Monoclonal antibody. It is targeting CD22. Again, it's wrong. I have told you, right? The Ritu, right? How did I ask you to remember? Ritu is right. I have told you to remember like this. Ritu is a girl in the age group of 20, right? Is the age group of 20. So this is going to target your right? CD20. It's a monoclonal antibody against CD20, right? Ritu, and then there is another one, Ofatumumab, right? So I told you to remember, Ritu is a 20-year-old girl who will not do Wafa, right? Ritu Wafa nahi karegi, right? So this is not 22, this is 20. Can it be used in CLL? Yes, it can be used in the CLL. Okay, it can be used in the CLL. Okay, and in the CLL, the regimen that we use is known as your FCR regimen. Guys, what is FCR regimen? Remember, this is also very important thing. right? FCR regimen, that will be your fludarabine, right? Fludarabine, right? C stand for your, right, cladribine, fludarabine, sorry, cyclophosphamide. C is your cyclophosphamide, and R stand for rituximab. Okay, rituximab. So that is your FCR regimen. So definitely it is used in the CLL as well. So your examiner can simply ask you FCR regimen is used for CLL, and since I told you it is used in the CLL, yes, it is used in the CLL. Correct answer that we are having rituximab. Yes. The uses of rituximab that we are having. What are the uses? Ritu is a 20-year-old girl. She will not do Wafa, and she can be used in the condition that can be remembered by the mnemonic Krishna. Right, that is your CLL. Yes, it can be used. It can also be used in the, right, CLL. Right, can also be used in your rheumatoid arthritis, idiopathic thrombocytopenic purpura. Right, can also be used in your, right, SLE, right, and non-Hodgkin's lymphoma. Can also be used into non-Hodgkin's lymphoma. So multiple uses are there. Just remember, right, it is not a CD20, but it's a CD20, a monoclonal antibody against the CD20. Okay. Next question. Which of the following monoclonal antibody used in the HIV and act by inhibiting the viral entry? Right, a monoclonal antibody act by inhibiting the viral entry. Please provide your answer for this question. Okay, Bezlotoxumab, Maraviroc, Ibalizumab, and Reslizumab. Okay, let us see how many of you can get this easily. A monoclonal antibody that is used in the HIV act by inhibiting the viral entry. Which of the following act by inhibiting the viral entry for the, right, HIV? Remember this question. Please start providing your answer, guys. Whichever do you think is the correct answer. Dr. Duri Ravi Shankar is in favor of C. Other students, please. बाकी सब लोग भी बताइए. Okay, Yashraj is also in favor of C. Right. Rest of the students, they are joining in between. I think you guys did not receive any notification about this, so that is why this problem is occurring. Okay, majority of you are in favor of C actually. Okay, Ibalizumab, so that's a correct answer, right? Ibalizumab, that's a monoclonal antibody against CD4 receptor, right? CD4 receptor, monoclonal antibody against CD4 receptor. Okay, Ibalizumab. Guys, Maraviroc itself, first of all, remember all the monoclonal antibody will be ending with the MAP. All the monoclonal antibody, they end with the MAP. So Bezlotoxumab is a monoclonal antibody, but Maraviroc is not a monoclonal antibody. Maraviroc is not one of the monoclonal antibody. Okay. Then you are having Reslizumab. So as I told you in the previous question as well, Mepolizumab, Reslizumab, this is one of the interleukin 5 antagonists that can be used for the bronchial asthma. Right, it can be used in the bronchial asthma. Bezlotoxumab, remember how to remember this? B for Bezlo, right? B for Bezlotoxumab. This is mainly used for your Clostridium, right, difficile, right, a monoclonal antibody that is used against Clostridium difficile, that will be your Bezlotoxumab. Okay, toxin है ना, toxin word आ गया. So toxin is for the toxumab. And how to remember? B, right? Remember B, right? C, right? And Clostridium difficile toxin B के against it will be acting, Bezlotoxumab. So B and C, Bezlotoxumab for the Clostridium. Ibalizumab is a monoclonal antibody against a virus, right? Then remember, this question has already been asked about the palivizumab. Palivizumab. Okay, so this is also one of the palivizumab is a humanized monoclonal antibody against the virus. Okay, against the virus. So this is used mainly for the RSV in 2017-18, either in 17 or 18. This question has already been asked about which of the following monoclonal antibody is used for a virus, either in 17 or 18. This question was asked in the NEET PG main examination. Okay. So palivizumab for the respiratory syncytial virus, mepolizumab, reslizumab for the bronchial asthma, ibalizumab against CD4, right? Ibalizumab against CD4, right? That is going to act by inhibiting the viral entry. Maraviroc will also act by inhibiting the viral entry, but by binding at a different site, right? By binding at a different site, CXCR4. Okay. Very good, Dr. Shantan Basu. Yes, Clostridium difficile, right? Type B. I hope it is clear to all of you, and we are going to discuss the next question. A 35-year-old female presented with the history of chronic migraine. All of the following can be used in the prophylaxis of the migraine except. Question is very simple, right? In migraine में all of the following will be used except, right? Which of the following will not be used for the migraine? Please do remember that. Okay. Please let me know the correct answer, guys. What do you think would be the possible answer for this? botulinum toxin, Actiniumab, Topiramate, Epratuzumab. Right, let us see how many of you can get this easily. Right, all of the following are used for the very simple question is asking which of the following is not used in the migraine prophylaxis. Right, I'm sure all of you guys are aware that the drug of choice in the prophylaxis of migraine, is your propranolol. Right, propranolol is considered the drug of choice in prophylaxis of migraine. Yes, okay, so students have already started answering this. Right, correct answer they are answering, very good. That is your Epratuzumab, very good. Epratuzumab is the correct answer. This is one of the monoclonal antibody. This is one of the monoclonal antibody against CD22, है ना, CD22. So Ritu was 20 and Ritu के ऊपर, right, ऊपर will be Epra, Ritu के ऊपर will be 22, है ना. Ritu से भी ऊपर, है ना, उससे भी ऊपर 22 आ जाएगा ना. Right, Topiramate, Actiniumab can also be. Remember, there are certain monoclonal antibody that are approved against the, right, migraine. Right, that is your Actiniumab. Yes, Actiniumab is one of the monoclonal antibody that has been approved. Okay, Actiniumab. Then Fremanizumab. Fremanizumab right, Galcanezumab. Okay, Galcanezumab, it's very easy for you to remember. Right, EFG, these are the monoclonal antibody against the migraine. Please do remember this. They are the newer one and they are readily available in your textbook. It's not like I'm giving you from study data, I'm giving you the information from your textbook. So EFG, Actiniumab, Fremanizumab, Galcanezumab, they are the approved. How to remember this? They are for the neurons, right? So remember, right, neuron, nervous system, headache के लिए बात कर रहे हैं. So Actiniumab, Fremanizumab, Galcanezumab, these are the monoclonal antibody against the migraine. Apart from this, drug of choice for prophylaxis of migraine will be propranolol. Right, now whenever we talk about the propranolol, apart from propranolol, what else that you can use? Right, so you can use anti-epileptic drug that can be used against the migraine. What are the anti-epileptic agents that can be used against the migraine? So anti-epileptic drug, I'm sure all of you guys are aware about this. It's very easy, na? Topiramate, है ना, Topiramate. Then you can even use the Valproate, है ना. Topiramate, Valproate, they are the approved agent also, right? Topiramate, Valproate, they are the approved agent. Apart from this, you can even use certain TCS, tricyclic antidepressants can also be used, right? Then you are also Candesartan, one of the angiotensin receptor blocker that is also approved for the prophylaxis of the migraine, right? Candesartan. Then you also have the clonidine, So बहुत सारे ड्रग है for the prophylaxis of migraine, and moreover you should also remember that injectable form में botulinum toxin is also one of the FDA approved drug. Every 12 weeks injectable form में it is given directly over the temporal region for the prophylaxis of the migraine. So botulinum toxin, remember, it's also an approved drug. What is not for the migraine is your Epratuzumab. That is mainly Epratuzumab is mainly against CD22 and this is mainly used for the SLE, right? Mainly used for the SLE. Okay, I hope it is clear to all of you, and we can proceed to the next question. Okay, we can go to the next question. Next question is relatively very easy, and I'm sure all of you guys can, all 100% of you can get this easily. This antimalarial agent act by interference in the folate metabolism. An antimalarial agent act by interference in the folate metabolism, that will be your atovaquone, artemether, pyrimethamine and lumefantrine. Okay, which of the following antimalarial drug will be acting by the interference in the folate metabolism, right? Folate metabolism को कौन interfere करेगा? Please provide your answer, guys. Whatever do you think is the possible answer? Okay, so majority of you are in favor of C. Okay, pyrimethamine, interference in the folate metabolism, guys. So this is a absolutely correct answer, right? Folate metabolism. Okay, folate metabolism, pyrimethamine. Okay, pyrimethamine sulfadoxine, है ना? These are the drugs that are acting by the folate metabolism inhibitor, right? Artemether that we are having, that is acting by your free radical generation, right? Free radical generation के through काम करेगा, right? Then you should remember some antimalarial drug that is also acting by different mechanism, like antimalarial drug that is acting by the heme metabolism inhibitors, right? Heme metabolism inhibitor, they will not allow the, right, they will inhibit the uptake, or they will inhibit the utilization of the heme inside the parasitic food vacuole by forming the clump, है ना? Clump form कर जाएगा food vacuole के साथ, and they will not allow the use of this parasitic heme, right, for their survival. So heme metabolism inhibitor will be remembered by the very simple mnemonic that I must have told you in my previous classes, is your long MCQ. What is long MCQ stand for? That is your lumefantrine, है ना. Long MCQ stand for your drugs like your lumefantrine, है ना, lumefantrine, right. MCQ stand for your mefloquine, lumefantrine, right. Then your chloroquine and your quinine. See how easy it is, right. ना lumefantrine, long MCQ, lumefantrine. So long MCQ आपका खून जलाते हैं ना. Very simple way to remember, right. So long MCQ, right. Lumefantrine, mefloquine, chloroquine and your, right, quinine. These are the drugs that are mainly acting by the heme metabolism inhibitor. Okay. Not only that, you should also remember mitochondrial function inhibition of the mitochondrial function. Which of the following antimalarial drug acting by inhibition of the mitochondrial function? That is your atovaquone, है ना, atovaquone. Artemether, I have told you already, that is mainly acting by your free radical generation. Okay, all the artemether, right, artemether, artesunate, है ना, all of them. Okay. So lumefantrine that we are having is one of the drugs that is acting by the heme metabolism. Pyrimethamine is not used alone usually. Pyrimethamine is used with the sulfadoxine. Pyrimethamine sulfadoxine. Okay. Let's get started with the next question that we are having. Which of the following is a contraindication of chloroquine? So chloroquine is also a very hot topic nowadays, right? I'm sure you guys are aware that it was used very widely. It is used currently as well in the COVID, and it's one of the very hot topic. So you should know things about chloroquine as well. Which of the following is a contraindication of chloroquine? You'll have to tell me one of the contraindication of chloroquine. Is it psoriasis? Is it lepra reaction? Is it rheumatoid arthritis? Or is it amoebiasis? Please start providing your answers already. Contraindication of chloroquine. Let us see how many of you can get this. All the students, those who are live, please provide the answer. Okay. Lepra reaction, that is Dr. Aditya is saying B, Shantan Basu is saying A. Other students, सब लोग try करिए, जितने लोग हैं सब लोग try करिए, है ना. Dr. Akhila is in favor of A as well. Psoriasis, okay. So majority of you are going in favor of A. Contraindication of chloroquine, yes. So psoriasis, remember psoriasis. Right, whenever we say contraindication of chloroquine, so it can be used, right, it can be contraindicated in a G6PD patient because it is causing hemolysis. It is causing hemolysis, therefore contraindication in G6PD. It is also contraindicated with the antacid because antacid is going to interfere in the absorption of the drug. Okay, then it is also contraindicated in the psoriasis. Right, it is also contraindicated in the psoriasis and porphyria as well. Right, psoriasis and porphyria को भी ये exacerbate कर सकता है. Therefore, it should not be given in this patient as well. Right. So remember, chloroquine contraindication will be gap. Gap are the contraindication of chloroquine. Very simple way to remember, not very difficult. Okay. Lepra reaction, for all those who said, guys, lepra reaction is an indication. Lepra reaction, rheumatoid arthritis, and amoebiasis. These are all, right, especially extra-intestinal amoebiasis. It is used mainly in the extra-intestinal amoebiasis may, especially it can be used. Okay, especially in the extra-intestinal amoebiasis. So chloroquine can be used. Okay, and in the usual classes I must have told you as well that the chloroquine that we are having, it can be used in multiple conditions, like for example your photogenic reaction, rheumatoid arthritis, extra-intestinal amoebiasis, malaria very commonly used, right? Currently COVID-19 it has multiple roles, and in my previous lectures I have already told you what are the different roles of chloroquine. Right, different roles of chloroquine I have already told you. Okay, it can also be used in the discoid lupus erythematosus, infectious mononucleosis, and lepra reaction, especially type 2 lepra reaction, especially your type 2 lepra reaction में it can be used, mainly type 2 lepra reaction में. Next, this agent dabigatran acts by, let us see how many of you guys can get this. The agent that we are having, dabigatran, all the students, those who are live right now, please provide your answer for dabigatran. Is it a direct 2A inhibitor? Is it a direct 10A inhibitor? GP2B3A inhibitor or ADP inhibitor? Not a very difficult one. I'm sure all of you guys can easily get this. Dabigatran, जल्दी से start कर दीजिए आंसर मारना. Is it a direct 2A inhibitor? Direct 2A is direct thrombin inhibitor, है ना? Direct thrombin inhibitor. 2A is thrombin, है ना? 10A inhibitor. GP2B3A inhibitor. Okay. Alright, so you guys have started. Some of you are in favor of C, others are in favor of A. Okay, so all those who are in favor of C, सबसे पहले उनसे बात करते हैं. Right, GP2B3A inhibitor are the drugs that we are having by the name of abciximab, tirofiban, right, ft-fibatide, FT fevertide, right? These are the GP2B3A inhibitor, है ना. ADP inhibitor तो mainly your P2 white cell inhibitor, right? P2 white cell is the receptor of ADP, and these drugs will be your drugs like your clopidogrel, है ना, clopidogrel. You'll also be having your prasugrel, right? Clopidogrel, prasugrel, these are the, right? Then you're also having others. These are clopidogrel, prasugrel. You're also having your cangrelor, है ना, ticagrelor, है ना, cangrelor, ticagrelor. These are all the, right, ADP inhibitor, right? Cangrelor, ticagrelor, remember, these are the reversible inhibitor. These are the reversible ADP inhibitor, and clopidogrel, prasugrel, these are the irreversible inhibitor, है ना. Clopidogrel, prasugrel are the irreversible inhibitor. Okay. Dabigatran that we are having, guys, dabigatran is one of the drugs that is acting by direct. It is one of the direct thrombin inhibitor. Which of the following is an indirect thrombin inhibitor? Which of the following is one of the indirect thrombin inhibitor? That will be a very good example is your heparin, right? Heparin is going to activate or increase the activity of antithrombin 3 around 1000 times, right? And then that is going to bind your factor 2A and factor 10A, right? But direct will be your drugs like your, right, direct thrombin inhibitor. I can write here direct thrombin inhibitor. This direct thrombin inhibitor drugs are your drugs like your hirudine, है ना. नाम बहुत आसान याद करना, direct inhibitor hirudine, right? Then you are having the lepirudine, hirudine, lepirudine, right? Bivalirudine, hirudine, lepirudine, bivalirudine, ergatroban, right? Ergatroban, right? Melagatran, right? And dabigatran, right? Dabigatran. So out of all of them, one thing that you should know, that they are the direct inhibitor. They are the direct thrombin inhibitor, right? Direct inhibitor. See, direct inhibitor or thrombin antagonist. Okay, thrombin antagonist, direct inhibitor or the thrombin antagonist. Out of all of them, these all R's that we are having, they are all injectable route. They are all given by the injectable route. It is only dabigatran. It is only dabigatran that we are having that is given by the per oram route. Dabigatran is the only one that is given by the per oram route. Okay, dabigatran. So that is something that you should know, and it's very commonly asked question. Dabigatran is, what is the route of dabigatran? That is your, right, oral route, dabigatran. Okay, 2A inhibitor. Okay, the 10A inhibitor, for all those who said 2 as an answer, remember 10A inhibitor are the drugs that is having apixaban. So ये बहुत आसान है और बहुत important भी है, because in your examination definitely question can be okay. So 10A पे बैन लगाने वाले ड्रग apixaban, है ना, edoxaban, apixaban, है ना. 10A पे बैन लगाने वाले ड्रग apixaban, edoxaban, betrixaban, है, betrixaban. So all these drugs are the 10A पे बैन लगाने वाले ड्रग, है ना. So they are the 10A inhibitor. I hope it is clear to all of you, and there will be no doubt in future if ever the question is asked on this topic, है ना. कभी भी question इस topic से आता है तो please do not hesitate at all and mark the answer very confidently that the 2A inhibitor can be two types. One is indirect. Example will be your heparin, right? Low molecular weight heparin. Okay, heparin, low molecular weight heparin. Okay, they are all indirect thrombin inhibitor. Okay, rest I have already explained it to you here. Okay, dabigatran is the one that is your thrombin antagonist. Okay, I hope it is clear to all of you. Next question. This antidepressant drug which is used for smoking cessation. This is one of the NEET question, and I hope all of you guys can easily get this. Venlafaxine, topiramate, bupropion, and amitriptyline. We are about to finish because this is short session and around 8 to 10 questions only can be covered in this time frame. But believe me, each of these questions that we are discussing from a different topics, they are you can say the most important topics that has been asked from the last 5 to 6 years. Okay. C. Okay. C. Okay. Very good. So it's very easy for you to remember as well. C. And a bupropion, piona. Right, so they are the atypical antidepressant, atypical antidepressant, not usual typical antidepressant. The typical antidepressants are, what are the typical antidepressants? Usual typical antidepressant that we are having, guys, they are the SSRI, SNRI, right, tricyclic antidepressants, right, selective serotonin reuptake inhibitor, right, serotonin norelin reuptake inhibitor, tricyclic antidepressant. They are the typical one. Atypical one that we are having is a bupropion is one of them, right? Bupropion is one of bupropion, mirtazapine. They are the atypical ones, right? And bupropion is having additional. They are having additional nicotinic receptor agonistic property. Nicotinic receptor agonistic property. Because of this nicotinic receptor agonistic property, right, they can also be used for the smoking cessation, right? Smoking cessation के लिए it can be used. Okay. So remember this. Correct answer that we are having is a bupropion. Okay. not the others, right? Not the others, right? So they are having the additional nicotine receptor agonistic only. I hope it is clear to all of you. And other drugs that we are having in this class, guys, like topiramate is one of the anti-epileptic drug. Topiramate is one of the anti-epileptic drug, है ना. अब ये एंटी एपिलेप्टिक कैसे काम करता है, प्लस इट इज ऑल्सो हैविंग मल्टीपल नॉन एपिलेप्टिक यूजेस. ओके, सो यू शुड ऑल्सो रिमेंबर, वेरी इंपॉर्टेंट, द ऑन दिस स्लाइड आई विल टेल यू टू रिमेंबर एटलीस्ट नॉन एपिलेप्टिक यूजेस ऑफ टोपिरामेट. टोपिरामेट तो यूज करते ही हैं एपिलेप्सी में, बट नॉन एपिलेप्टिक यूज ऑफ टोपिरामेट, रिमेंबर इट्स वन ऑफ द FDA approved drug for the use of the obesity along with the phentermine. It can use, it can be used for the obesity. Okay, what are the other non-epileptic use of topiramate? Can any one of you guys tell me? If you guys have been reading pharmacology since beginning, I think this topic I have taught you multiple times. One non-epileptic use of topiramate is your obesity. What are the other non-epileptic use, right, apart from obesity? Can it be used? Yes, obesity के लिए होगा ना तो weight loss कराएगा, because one of the side effect of topiramate is your weight loss. So what are the other apart from this? इसके सिवा क्या होगा? Other than this, what else? Dr. Duri Ravi Shankar, ये हो गया, obesity हो गया. Next, it's also one of the drugs that is used for the prophylaxis of the migraine, right? It also reduces the alcohol craving, है ना, alcohol craving को भी कम करता है. It also reduces the alcohol craving by its, है ना, NMDA blocking activity, right? Plus it is also having activity against the receptor as well, right? There is a glutamate, right, and anti-glutamate activity, anti-glutamate receptor. So that will be mainly helpful in the epilepsy only. Okay, epilepsy में. Plus it is one of the voltage gated sodium channel blocker. So this is known to everyone. It is one of the voltage gated sodium channel blocker. No problem. I have summarized it here. FDA approved drug for the obesity, prophylaxis of the migraine, and epilepsy. तो use है ये इसका. It decreases the alcohol craving as well. Okay. Next and the last question for today. Which among the following agent is an SNRI? Very simple question, and I don't think there will be any more simple question than this. Okay, which among the following is an SNRI? The last question for this day. Please provide your answer. Venlafaxine, selegiline, amitriptyline, and fluoxetine. Which of the following is an SNRI? So I think options are quite similar to the previous question, but you'll have to choose, because your examination and especially the NEET also, right, they have asked this question multiple times, that identify which of the following is SSRI, which is SNRI, right? You'll have to identify. So answers have started to come, guys. So that is your venlafaxine. Very good. So that is your SNRI, right? Serotonin noradrenaline reuptake inhibitor, that is going to increase the level of your serotonin, and it is also going to increase the level of the noradrenaline. Okay, it will be increasing the level of serotonin and noradrenaline. So what are the drugs under this serotonin noradrenaline reuptake inhibitor? Remember, venlafaxine. Venlafaxine, right? One of the conjugate of the venlafaxine that we are having by the name of desvenlafaxine, right? Right, duloxetine, right? Duloxetine, right? Milnacipran, right? Milnacipran, right? Levomilnacipran. So these are the agents that are coming under the SNRI. Okay, so how to remember this? Very easy way to remember. See, SNRI, you are going to increase the level of two neurotransmitters. What are those two neurotransmitters? Serotonin and noradrenaline. And you can easily remember this, right? You can easily remember this by the very simple mnemonic. Venlafaxine sounds like vanilla, right? Vanilla, the ice cream, right? Whenever I use vanilla ice cream, so vanilla duals, though, increasing the level of two neurotransmitters. Vanilla duals my love. Okay, very simple way to remember. You will never forget this. Okay, venlafaxine is vanilla. Vanilla duals my love. Okay, try karna kabhi vanilla, it will dual your love. Okay, so vanilla dual my love, that is venlafaxine, duloxetine, milnacipran, levomilnacipran. Right, what is selegiline? Selegiline is one of the drug for the MAO-B inhibitor. Selegiline, rasagiline is one of the MAO-B inhibitor. Okay. Amitriptyline, guys, is one of the tricyclic antidepressants. Okay, amitriptyline is one of the tricyclic antidepressant. What actually is a fluoxetine here? What is fluoxetine? Right, fluoxetine, norfluoxetine, है ना? They are actually your, है ना, SSRI, selective serotonin reuptake inhibitor. तो 4 drug हैं different class से, and you'll have to choose one drug from the SNRI. I hope it is very clear to all of you, right? Yes, varenicline can also be used for the smoking cessation. Yes, doctor, can be used. Dr. Shantam also, yes, can be used. Right? Okay, varenicline भी use कर सकते हो, ना? That is okay. So correct answer for this question is not fluoxetine, Dr. Vinod. It's actually A. Okay, A is the correct answer. Okay, A is the correct answer. So that will be everything that I wanted to discuss with you guys about this class. And just for your information, that if you are one of the NEET PG 2022, then you can practice pre-MCQs every day at 9 p.m. at the Unacademy app. And if you are one of the NEET PG 2021, right, you can practice the MCQ 8 p.m. every day, right? 20 MCQs will be asked to you every day, right? At 8 p.m. you can practice. So 2021 8 p.m. 2022, right? You can download the app simply by going to your Play Store, Unacademy, and then you can choose the NEET PG section, right? In the NEET PG section, you can choose either plus courses, right, or the special classes, whichever, depending on your requirement, you can choose. Okay, so that will be everything that I wanted to discuss with you guys in this class, and I hope you guys learned something new, right? And I'll see you guys in upcoming more classes like this, right? If you're having any specific topic that you want me to discuss, definitely you can let me know. Apart from that, immediately after this, that means from 3 p.m. I'll be live at the Unacademy as well, so you can watch me there as well. So this is and then another session is from 6 p.m. and then another is for 8 p.m. So I'll be live at the app as well. You can watch it and you can practice lots and lots of MCQs, and my best wishes to all of you. All right, I'll see you guys in the upcoming classes like this. Take a very good care of yourself.